Yeah, thank you.
Yeah,
Say
good. Can
thank
I?
you very much for joining us. Once again, this is Adeyinka Olaiya, the Nigerian artist, journalist in Brazil. This time around, we're going to talk in English. Uh, I would have loved to speak in Yoruba as I promote the Yoruba culture, but with me is the president of Nigeria in diaspora or whatever, Americas. This is Brazil chapter. It is an organization formed, I think, President Obasanjo in those days to improve the status of Nigerians in diaspora, the business, whatever. He is the president here in Brazil, and uh, you are welcome, sir, to this program. And apart from that, this is Dr. Yusuf Adesina. He is a medical doctor, a cardiologist. Uh, I am his fan. Uh, you're welcome to this program, sir. Thank you for joining us. I would like you to say hello to Nigerians in Brazil, Nigerians worldwide, Nigerians every part of the world, so that they can hear you.
Thank you, Mr.
Welcome to this
Adeyinka.
program. Thank you,
Good
sir.
morning, everybody. Good morning, audience. Good morning, those that are watching. And
Yeah.
I'm very grateful. I thank you very much for having me here. My
Thank you,
name is
sir.
Yusuf Bamidele Adesina. I've been here for over 40 years. I'm a medical doctor in uh, 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 in the emergency unit, and I'm the president of Nigerian NIDOA Brazilian chapter. So as Mr. Adeyinka just said. So thank you very much for having me here.
It's a pleasure. Thank you very much for joining us. I can see they're already saying hi to you. I can see Abdul Rahman Olajide saying hello to you and thanking us for bringing you here today. Sir, if I should ask, who is Dr. Yusuf Adesina?
Yeah, if I can, Dr. Yusuf Adesina was a kid who left Nigeria, but when he was 18, 19 years ago, that's about 40 something years back, right? And he was a student of Lagos City College. From there to the Federal Emergency Science School at Victoria Island. After that, I came to Brazil to study medicine. From there, 6 years medicine, 6 years of heart surgery, and 2 years of cardiology. From there, and then there are other specialties that are, subsidiary specialties that you do as a medical doctor, which I wouldn't like to mention this here. So from that now, I'm working with the state government here in the state hospital and the municipal hospital. And I have a private clinic as well, and I work as well in a private hospital.
Wow.
That's what I have to say.
Wow. I think we are proud of you. Thank you very much for telling us this. For those of you who have not heard or now you are hearing from Dr. Yusuf Adesina. I can tell you we are proud of you as a Nigerian in Brazil. Sir, recently, it's sad, but I have to say we've been losing a lot of Nigerians to uh, heart attack. Heart attack. Uh, this is, in fact, I just don't know how to go about it. You are a cardiologist. Please advise us. What do we do? What are the securities? How do we prevent this tragedy?
It's not a tragedy. It's just what the Brazilian they call percurso da vida. That is, no, that's the streamlight of life. When you don't take the necessary step, what we see is what you are trying to mention. But is a case that heart attack. Heart attack. It doesn't start all of a sudden. It is a system. It is a what do you call heart attack? When you don't have blood flowing into your heart anymore through certain reasons. Let's say excessive, the blockage of the passage of the blood, of the blood to the heart. So automatically you can have heart attack. There are various types of heart attacks, but it gives signs. And if you don't care about these signs, you might come to the last stage of heart attack. But naturally, what I would like to say is this: if something that is, heart attack is preventable. It's preventable in one way, I can say, because you have some reasons for that. In the first case, what are the causes? It's just like say you are planting, just in a generic way. It is your future. I mean, your present is going to determine your future, right? And when you are having a problem, you have to look for the cause of this problem. And what we
But
do
sir,
in our daily
sir,
life,
somebody walking on the street, all of a sudden, answering a telephone call, fell down, gone.
you
So what do you say to that?
working on my screen here,
No, are you hearing me? We've had cases of a Nigerian somewhere in Itakera or thereabout just came out of the metro, normal, talking on the phone, all of a sudden
he fell
fell
down.
down and died.
Yeah, those are the things that what I'm trying to say is this. That is where I'm going. I'm trying to say is this: what are the causes? Look at somebody who is okay. Let's say the causes of all these things is this: when you don't control your blood pressure, it's giving you sign, right? When you don't sleep well, you have problem. It's going to overwork your heart. When you have some pathological issues, as a sort of high cholesterol, it's going to have impact on your body. When you are too stressful, it's going to have impact on your body. When you have diabetes, it's going to have impact on your heart. When there's certain few of these things that we are to measure. To mention so that we don't overwork our heart. Imagine somebody who is you never mentioned the I don't know the age of this guy, but imagine somebody who has been working for many years. The heart is the only machine we have got in our we have in our system that do not let's say is into rest. He's the one working all around the table, and all of a sudden what you have is this: somebody is diabetes, who is not sleeping well, who is not eating well, who is not, there are many things involved. And all of, what you see is this: he has not been to a doctor for many years. You are not being, just to check. At least when you have a car, you take it to the mechanic, or you don't even go to the mechanic. You know that you have to change the oil. You have to check certain things there. But there are some of us around here that we don't do any of these things. We feel that we are Superman, we are that. So automatically, when it comes, it is when we're talking. So what I will say is this to some of us that are here. Number one, you don't smoke. I cannot even say you reduce smoking. You don't have to smoke at all, because we have some certain disadvantage on smoking. That is that. You have time for yourself. That is, at least somebody who is not sleeping well is going to have a sort of repercussion on the heart. That is natural. If you are having high blood pressure, the signs is going to give you the signs. Maybe you're having headache, dizziness, you're unable to sleep, that is that. If you're having the excess of sugar in your body, it's going to be a disadvantage on your heart, and there are many like that. If you're having high blood pressure, if it's not controlled, it's going to have an disadvantage on your heart. So most of these things, stress is going to have disadvantage on your heart. When you don't do exercise, you feel that you wake up and and you keep on moving, and it's going to have get something disadvantage on your heart. All these things, there are measures that can do. Imagine you wake up in the morning, something that could be done in your house. You do a sort of some little exercise inside your room or in the house. It depends on where you are living. If you cannot go to the street to do it, 10-15 minutes is enough for you to make your body in a better form. Good food is another reason that can keep you okay, to help your heart. All these things, putting them together, is going to be a sort of a benefit on your heart. So if there's anything that I've not heard about that, most of the principal something are these that I just mentioned.
So, but we as Nigerians, we eat in a different manner. I must confess, we like our fufu. We like our fufu. We like our African food. We wake up in the morning, and in most cases, we don't even take our breakfast. We go straight to the real bahaku, our real African food. Is there anything wrong in that?
No, there's nothing wrong with our food. If we won't eat better than most of these guys you see around, the Americans, we won't eat better. We have one opportunity. Our food is made of fibers. So automatically, and this is the stuff, it has some, prevention on our body, on the earth. It's not the food. It's not the food that is making us have all these problems. It's not the food. It's our lifestyle.
Our lifestyle.
Our lifestyle. What I mean by our
So
lifestyle is this.
we should sleep well. We should eat
What I
well,
mean
do exercise, drink water.
Just a minute. What I mean by our lifestyle is this. 85% of what is happening to our body, we can control them. 15% is what we have to work upon. It just depends on us. But if we are able to take care of this 85%, automatically we are going to control the 15%. The 15% is 15 to 20% is our genetic factors, and aging. You get old, automatically all these things will be wearing out, and so if we are able to look at our environment, within the 18% is our fooding, the exercise, sleeping well, stress, environment, where you move, is the 18% that depends, 85% that depends on us. I don't depend on anybody to eat food, the type of food I'm going to eat. I don't depend on anybody. It's the lifestyle. If we're able to change the lifestyle or modify the lifestyle, then we will be able to combat at least to certain percentage, the 15% that does not depend on us.
What about
fufu has got nothing to do with, because our fufu is a very good food, right? Our eba is good food.
It's a very good food. Our akpu is good.
It's not. They are not good because they are, most of these, is natural food. They are not industrialized.
Okay.
As from other food stuff from
we
other
can eat our food in the morning.
No, it is not the time you eat food, because it's the culture. Eating certain type of food is the culture of that society. You understand me? That society, I feel that you eat very well in the morning. You eat, a little bit in the afternoon. In the night, you eat just small stuff
Okay.
because you are going to bed. You know why they said that you should eat very well in the morning? Because of the time factors. You stayed very long. Let's say you take your in the night, your dinner, let's say around 8 o'clock. From 8 o'clock to 7 o'clock or 6 o'clock, it's a very long period. So if you take, heavy food in the mornings, there's nothing wrong about that. So that is a culture. That's our own culture. Other culture, there are some people they don't eat much in the morning. But naturally, when you look at the factors of the time you stay without eating, if you eat in the morning, I got nothing to, it's not very bad. The American culture, they like eating hamburger and other things. It's quite different. When you say they eat a lot, but most of the food is not, edible. The food is not so healthy as such. The American system that we people are talking about.
So how would you
So
say, just in 5 words, for a Nigerian in Brazil to live well and to prevent sudden heart attack? Just say in 5 steps. Do
yeah,
this, do that, do
yeah,
this,
all
do
right.
that.
There are some of my patients, some of you who are my patients, they had this from me. It's very easy. How am I going to say this and in a way that you are going to understand me that, okay, let's say you
Just
wake
five
up,
steps.
you do
In the
exercise.
morning,
Okay,
yeah,
ordinary exercise
yeah.
will help you to prevent heart problem. Good food,
Exercise. Yeah.
exercise.
Okay.
You don't need to go to the gym or other things to do that. It's something that you could do in your house or in your environment, right? 10, 15 minutes every other day is okay, right? Control your blood pressure.
Control your blood pressure.
Yeah. Control your blood sugar.
Okay.
That is in order to prevent diabetes.
Exercise, blood
Yeah,
pressure, blood
yeah,
sugar.
yeah. I've said something about your blood pressure, blood sugar, cholesterol. Cholesterol is the
Cholesterol.
fat in the body. The fat, the cholesterol is the fat in the blood because it's the one responsible to block the heart vessels that is going to lead to heart attack, right? So you have to control that. This depends on the type of food you eat. When you eat good food and when you are preparing your food, in our society, we like putting excess of oil excess of oil. You don't need to put more, just about some drops of oil,
Oil.
to prepare our food. We don't need to put, half a bottle of oil to prepare our F4 or, you know, uh, our soup. You understand me? We don't need to do that. And, I mentioned that, and you sleep well. Make sure when you're having problem of, sleeping, then you have to see the doctor. When you're having problem of sleeping, when you see that your heartbeat, normal heartbeat is between 16 and 80, per minute. So when you see that your heartbeat is more than normal, or you are not sleeping well, or you are stressing yourself or you are dehydrated, you have to take water. When you don't take water, what is going to happen? Indirectly, you are overworking your heart because your heart is like this. It responds when you are dehydrated. The heart needs to take to pump blood to the brain, which is very important, to the heart, which is very important. And when you discover that one thing, when you go to the toilet, go to the toilet to urinate, you discover that your urine is very, very, it's not light. It's very concentrated. It's just like too brownish. Then it's a
Okay.
sign for you that you are dehydrated. So you have to take water, at least 2 liters of water a day, so that when you see your urine that is clear, and it's another prevention for you for the kidney. Because when you are dehydrated, what is going to happen? You are going to overwork the kidney. Automatically, while overworking the kidney, and when the kidney is gone, we are talking about the heart. When the kidney is gone, it's a big problem, because normally it's the heart that gives the last sign. It's not in the initial stage, you don't get it, you don't have it, you don't have failure. You have the kidney, the liver, and others. But these are the small, small signs that you have. At least normally you go to the toilet almost every day. Watch your urine. When it is too brownish, it is too concentrated. It is not lighter. It's not, light. It is not, how am I going to say, it is something light. It shouldn't be too concentrated. When it is concentrated, there is a sign that you will need water in your body. Because when you have this, when you are dehydrated, the heart has got to work faster. Automatically, imagine something working, instead of working, let's say 60 to 70 beating beats per minute. It will be about 100 and something, in order to pump blood to the other places, prime places in the body. So those are the small, little things that we have to do. That is blood pressure, diabetes, exercise, taking water, you sleep well, make sure you sleep about 7 to 8 to 9 hours a day. Let's say between 7 and 9 hours a day. You don't stretch yourself, cholesterol. Those are these, normal thing that we have to do. And make sure you see a doctor at least once in a year, or depends
Once
on
in
your
a year. Once in a
yes.
year.
Yes, at least once in a year, just to say, what I have, I don't have. I just want to see. It's as I do when you have, I'm using glasses. I will go to a doctor a year, once or twice in a year, to check my glasses. If I will need something else, I wouldn't allow to check my glasses, not to check my eyes. Naturally, at my age, I have to go to a doctor at least to check if my cholesterol is okay, or if my diabetes is okay, or if my blood pressure is okay. And he will ask me, what is your nature of job as well? If you are overworking yourself, it's going to have a sort of repercussion of on your body. So those are the small, small things that we can do for ourselves. And in the first case, you have to think of ourselves. Yourself first, then you think of others. But you do all this minor something for you. All these things you're talking about will not, we are not. It will not happen, even though it's going to happen, because we have certain age that we have things going on. When you are young, everything is okay. You can run from that place to the other. Your body will absorb it. It's going to absorb it. But when you are getting certain age, you don't have to stress yourself as it used to be, because your body, is just like say one of my friend. Well, I said slow motion. It's not as fast as it used to be. So everything at that age, you are going slowly. So you don't have to be stressful. You don't have to stress yourself on certain things. Not everything somebody does to you that you have to. No, not that. Or else you are going to overwork your heart. I don't
So
know
we are
if
so some questions are coming in for you. And I can see Nigerians are thanking you for showing up. Abdurrahman is thanking you for the tips you've just elaborated. We have Temi Ojediro saying more grace to you. We have a Souza Anthony, saying nice explanations. We have Temi Ojediro greeting you. We have Kabi Aderomu saying more grace to your elbow. We have Lou Barry saying hi. Adeola Shade saying good afternoon, sir. We have Chika Collins Emmanuel is asking you a question. I'm still coming to that. We have Uche Christian Zogwe. I don't know. He's saying well done, Doctor Naido. We are still coming to Naido. We are now talking of health first. Sir, let's just observe 1 minute silence for our who just left us. Dr. Emmanuel Oluwatui. Let him sleep well. Olódùmarè kó bá wa tẹ́ wọn sáfẹ́fẹ́ rere. Just a minute, sir. Yeah, sorry for going to that. I know you let him continue to sleep well. He was a fantastic person, an exceptional medical doctor, a leader. Olódùmarè kó bá wa tẹ́ wọn sáfẹ́fẹ́ rere. May Olódùmarè continue to guide the family left behind. Sir, that day I became your fan. You know why? I'll say something in Portuguese now. Eu pensei que sabia de tudo de medicina, mas eu não consegui salvar ele. That was a statement. Ele pediu a Deus para, né, para ter uma vida melhor. Ele conseguiu. Ele pediu a Deus uma família. Deus deu. Ele pediu a Deus dinheiro. Olódùmarè deu. Ele pediu a Deus a vida. Deus estava pensando. Ficou pensando. I had a statement from you that day. I became your fan. That even as a medical doctor, you gave the importance to God. Sir, recently we've been having this same thing happening to a lot of our doctors here. They teach us, they help us, but they've never been having time for themselves. Look at what Chika is asking here. Say, why have you been able to dedicate? Why have you been able to so dedicated in the affairs of Nigerians in Brazil, in spite of your very tight schedule as a medical doctor, medical practitioner?
Just to go back to what you had just said, related to, why? Some of us, we are fortunate in life. we had the opportunity, not because we are very brilliant, not because we are brilliant. It's because maybe we had a mentor, I don't know, or we had somebody that got a vision, and we had somebody beside us, which a family, you know. So it makes me to that if I can do something that is going to affect my urge, that others are going to gain, there's no reason for not doing that. So since my, my school days here, I had opportunities and I had a mentor. I had a mother, a father that told me where it went wrong in life and where he was doing well. That I should forget where those things that he did wrong, I should grab them and make sure I do not commit the same mistakes. And that is what I've been doing throughout my life. When I'm in an environment, when I say that I like to make that environment a very conducive environment to do my best to see that we're able to get something that every one of us is going to be proud of. That's what I've been doing, and trying to pass it to others. It is not what you have that is very important. It's what you do to others. That is, it's just from what the only thing that I did not like related to our the last this thing that to the death of our president is that there are certain things that you have to hold as positive, both for yourself and others. But I could not convince to do that. And unfortunately, you mentioned something that I could not say because he was admitted into my hospital. I know the positive and the negative part in my hospital. It's a public hospital, and there are certain things that it is not, interesting to be discussing here. The only advice I give
Yeah,
to people is that
yeah,
when you have
you
a
don't,
condition,
yeah.
when you have a condition to take care of yourself, you better do. Don't let others do that for you.
When you have the
When you
condition to take care of yourself,
have yourself,
when
you
you have
better
the
do.
condition to take
Condition,
care of yourself, do
you
that.
better, yeah. That is
Better do
very,
it.
very important. When you have the condition, because when you take care of yourself, it is when you are going to take care of others.
Hmm. Take care of
If you don't take
yourself. Hmm.
if you don't take care of yourself, it's going to be very difficult for you to take care of others. So when you have the condition, you take care of yourself. From there, you can take care of others.
Others.
So what is very
Thank
sad
you
in our
very
own
much.
case that now we lost Oluwatoyin.
Hmm.
Now Oluwatoyin cannot take care of others anymore
Because he didn't take care of himself.
because he did not. That those
Take care
are
of
the
himself.
small, small measures. It's not for you just to be walking. You are talking of about doctors. Some of our doctors who work 100 hours a week, old age, that is not good for the earth.
They must take care of themselves. Our doctors must take care of themselves so that they can take care of us. Thank you very
That is the
much.
theory. But it is not only Nigerian doctors. We have some Brazilian doctors as well. You know, but the theory is this: first thing you have to take care. How are you going to take care of yourself? All those things that I mentioned. You sleep well, you eat well, exercise, control your blood pressure, cholesterol, diabetes. Don't stress yourself. Those are the things that It is needed. Are very simple. Most of the doctors, they don't sleep well. And when you don't sleep well, what is going to happen? There's something they call, with Brazil, they call it radical livre. That is free radicals in our body. Those are the things that destroys our organs. When it is accumulated in our organ, it's going to destroy the cells. Automatically, we are going because the immunity is, is very low, and others will attack. The enemy will attack. When you are tired and you are going to fight, how are you going to fight? That's the
Very much.
theory. We are tired. Somebody is tired. You say go and walk. He's not going to produce anything. He's not going to be productive.
A tired person.
Yes.
So somebody asking a question here, asking if is heart related problems, can it be generational? Can it be something from the family or thereabout? Heart problems, can it come from?
No, there are certain things. That is why I say lifestyle. Okay, let me cite one example. In a house where everybody is dreadful, automatically, when there's a problem, say it's genetic, because my father died of that, my mother died of that, and all that, so I will do the same thing. It might happen. Genetics is very, very important. But in a house where everybody is dreadful, automatically everybody is going to die of stress. In a house when everybody eat bad food. When I say bad food, everybody is fat. You see a small kid about 3 or 4, 5 years old is very fat. When he was born, he was tiny. Now, because the family, they eat bad food, excess of cholesterol, and other things, they get fat, bad food. Everybody be fat in that. Automatically, what is going to happen? The father is going to die of heart attack. The mother might die of heart attack. The brother might. So you can attribute those things to be genetic. It's not like that. It's because of the lifestyle. Genetics is there, but lifestyle is very, very important.
Sir, there are greetings from. There's a greeting here from Switzerland. Pat Sanchez from Switzerland, greeting you. There is Luafemi Onosonya. He asked the question. That's Gabriel Adesina saying hi. Chika asking you if consumption of alcohol can also affect our health. And, a lot of greetings are coming in for you. Temi Ojediro, Afolabi Afonso, saying they are here. They are listening to you. But this interview is very important for those of us that live in Brazil. Principally, we've been losing our friends and families to sudden heart attack, and it's been rampant here in Brazil these days. We had a very terrible time with COVID-19 here in Brazil. Lives were, wasted lives. And he's our medical doctor, Dr. Yusuf Adesina. He's a cardiologist and the president of Nigeria in Diaspora Americas, Brazil chapter. We're still going to ask questions relating to NIDOA. We are still tackling health. Like he said, take care of yourself before taking care of others. Take care of yourself, visit your doctor, do exercise, eat good food, less stress. Sir, not having money can give heart attack.
What?
You're not having money. A man without money in his pocket to take care of his family will bring stress. That stress can lead to heart attack. Do you agree with me?
No, it is not. I don't know. It is relative when you say we're not having money. Because what we mentioned right now has got something to do with money. You understand me? What we mentioned is that eat food. When we say good food, is that you wake up in the morning, you take your breakfast. Your breakfast might be a coffee. It depends on your culture. Maybe one slice of bread, right? And a fruit,
Yeah.
it doesn't cost much. What I mentioned that is it's not going to cost you even here. It's just it's just like saying somebody that goes to the fin de feira. You know what it's called fin de feira? At the
Yeah,
end of the year, when you go there with ordinary 20 reais, I have
okay.
personal friend,
Yeah,
somebody
yeah.
very close to
That,
me.
that's our tactics in those days. We go at the end of the fair and buy it cheap.
Yeah, yeah, he's going to very, very cheap. You buy many things, about 25 kilos of foodstuffs. When I say foodstuffs,
Yeah.
fruits. And these are very, very important for your health. And they are
Fruits
very
are
cheap
very important. Eat
for your
fruits.
health.
Hope you are
Fruits,
listening. Fruits are very
any
important.
of the fruits. Our
Any of the fruits.
opportunity in Africa is this because we eat efo, we eat ewedu,
Okay.
and our is fiber that is having anti-cholesterol effect. Our
Effect.
mala, our iyon. What we don't understand is this: for the fact that we have greedy leaders, all
Hmm.
these things
Sir, we are
are
still going to that.
very good.
No, no, no. Don't let us go to that now. We want to tackle
Yeah,
health now.
no, yeah, we are. I'm not trying to say all these things are something that we don't need to do. We can, because it's what these guys they use to them over there produce medicine and send it back to us as an
Okay.
expensive
Okay.
product. So for the fact that we are eating all this, okay, let me just mention some related to virus that happens.
Okay.
When we were about to, when this disease started, the record was that people are going to die on the street of Africa, right?
Hmm.
Reason why we did not die in Africa is because of what we are eating. Some people say because we are taking medicine. How many people are taking medicine in Africa? It is because of our lifestyle and our foodstuffs. But nobody up to today had the courage to come and take the blood test why Africans did not lose their lives in the COVID
Yeah, yeah, yeah. 19.
pandemonium. So automatically, this is at the studies. We don't have studies for it at the moment. Some people are talking about age because we have on old age. I mean, young people in Africa. What of the old ones?
Yes.
How many old people in our family within this period we are talking about that makes difference of the death rate?
Hmm. That's
We have
interesting.
thousands of the old ones that died here. The
That
old
idea.
ones in Africa, in our family. Let's
Hmm.
use our family as an example. How many
They
old
survived
people
it. Men survived it.
died exactly? So
Survived it.
those are the things, the studies, we don't have that right now. Maybe one day, one or four, because whatever we want to do, we say Europe, we use European experience, but they forgot that the environment is quite different. We use American experience, environment is quite different. There are some medicine that you take in Europe, if you take in Africa, it's not going to work because the environment is quite different. The
Quite
body is
different.
quite different. The genetic factor is different. There are many things that are involved that are quite different. That so whatever you want to do in Sao Paulo, you cannot do that in Amazonas. It's just like somebody look at that. Look at imagine I always said somebody if you want to have heart attack, please have heart attack around Paulista. You know
Hmm.
why? Because we have the infrastructure, I mean, the structure, medical structure around Paulista saves your life when it comes
Hmm.
to heart attack. Is the medical structure. So the way I'm going to treat somebody that is going to having problem in Paulista is not the way I'm going to treat somebody who is having problem in Tiradentes. I have to use
Wow.
the structure of Tiradentes. I have to use the structure of Campo Limpo.
Campo
I have to
Limpo.
use the structure of Itaquera. What are the
Takera.
structures? This is what I have with me. When you
Wow.
have an attack, I
I've
say,
never thought of this.
is I say heart attack, what I have, I use it, and the next ambulance to take you to where the structure is. Because I have seconds. I have
Wow.
seconds,
I never
minutes,
thought
not hours.
of this.
So I cannot be thinking. I have to do
Wow. Hmm.
because I don't have time to think.
Wow.
I have seconds to do. So automatically, what I do is that structure, I use it over there and get my phone to the next structure. I have so patient. I've done this, I've done that. If I don't get this ambulance within, most of the time, my problem at times are the ambulances that we don't get on time. And we might lose the patient because of that.
Wow. Wow. I've never thought of this. I've never thought of this.
Yeah, but that's how it works. If you are around Paulista, the chance of, Paulista, Murumbi, and others, the chance of getting your life, when you have heart attack, it is higher than when you are very far away.
By the way,
Because very far
that's why we
away,
should take
most
care
of
of
the time you are
ourselves.
going to use the structure we have. And that structure might not be there.
So there's a question here from Darling, if I'm not mistaken, from Mr. Darlington George. Thanking you for providing this interactive platform, actually, to touch on health habits. Dr. Adesina, how often should an adult Nigerian go through routine like medical checkups?
I'm not trying to, it is not, I think I've said it once. Maybe that it came late.
Once in a
Once a
year.
year. Once a year.
Once in a year.
Yes.
Yeah.
Once a
You said
year.
it.
It's something and it's something that's going to take, it's once a year. When you go to a doctor, what is going to do? What are you having? Doctor, I don't have anything. I just want to check. Yeah. Then he will ask for routine test. What I mentioned, cholesterol, blood sugar, electrocardiograms, X-ray. It depends. You can even say, I want to do echocardiograms related to the heart, just to know the muscle of the heart, if something wrong, if the valves are working well, because there are some people, they got congenital factors that there's a problem in the heart, but it's not giving problem. It's not giving you any, you can do your daily activities normally, but it's there.
Yeah.
But you can get this through these routine exams that you do once in a year or every 2 years. It's just
So
like
I
somebody
think
say, but there's something in my heart that that I say, yes, leave it there. Is it giving you any problem? Are you able to jog? You're able to play, you are able to swim, you're able to do all these things. Forget about it. It's not a problem. It's not because it's there, I have to go there and remove it. No, you don't do that. If it doesn't give problem, you don't do that. But what you have to know is that it's there. In case of anything, you will be able to, it's just like
I
somebody
think
that, somebody we go do and do X-ray or let's say tomography. Tomography to check your brain, in the case of the brain, just in the tomography, when you have we call it aneurysm, that one you have to do something because that can explode. And it'll be giving you sign of headache and dizziness and other things. In that case, you have to do something. You cannot allow that to explode. If there's an explosion, then it's going to lead to a big problem. And it's not a big surgery. But there are other things that you cannot, okay, it's there. So I don't do anything, I don't have any problem, you forget about it. So normal routine every year or every 2 years, depends on the age. You go and see doctor. It costs you nothing. It's not very expensive if you are going to pay. And if you don't want to pay, we have the opportunity of having free medical. We have SUS. The time is the time that it's going to take. Instead of seeing it next week, maybe you stay for another 3 months or 2 months, but you will still see a doctor.
Thank you very much, sir. It's this is. Can assure you, I think we need to always, at least once in a while, repeat interactive program like this with you. This is, in fact, I can just imagine. A lot of things that we thought we like. I thought actually I didn't know these things you're saying now. It's very important that we at least visit our our doctors once in a while, do exercise, eat good food. I was always condemning someone like me. I hardly eat the African food because I don't go to African restaurants. You know, with what you're saying now, I think I have to change everything. In fact, it's a big pleasure having you with us here on. This is fantastic. It's fantastic. We need we need you. We need you. We need you. And I hope to also receive other doctors too. And I think we have doctors that are also in the area of fertility. And if I'm not mistaken, we have doctors that are, this is interesting. Thank you very much for this program, for coming up, for talking to us. And the Nigerians know you. This is our president of, no, yeah, it's also our president. Naidu is also Nigerian in diaspora. America. I don't know how to say it very well. Brazil chapter. Thank you very much for being with us today. We're gonna move a little bit to NIDO. 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 Let's talk a little bit about NIDO. We know NIDO represent what's actually NIDO. NIDO is I think that's business something within Brazil and within the international community and Nigeria, isn't it? I think NIDO is
Is not. I'm not a businessman. Maybe I may not be able to. You know, what I know about NIDO is this: is that Nigeria is an organization that been formulated by the former president of Nigeria, who was General Obasanjo in the
yeah.
early 20s, and to get Nigerian professionals back home.
Yeah.
That was the objective.
Yeah.
Business and other things, but that one can be a sort of collaterals. Is to
Yeah.
get Nigerians to back home and get some structure, the knowledge they got over there, to be back home and to support, our Nigerian government with what they're having in their heads for the development of our society.
Yeah.
That is, at least to my own knowledge. And since then, we had Dr. Opalogun, who was engineering in that time here in Brazil. And later, after the death of Dr. Opalogun, we had Professor Joshua, and then from there, we had Honorable Darlington, and now myself. But I think to me, there's something that is not been encouraging. We are trying, but we're not been encouraging because there are some political issues that we cannot be discussing here. Because what I feel is that there should be a structure in Nigeria for those of us, especially in the medical line, because it's the medical people that we seeing that they are not going back home. Apart from, we have many of them, and we see medical, paramedicals and medicals that are even leaving Nigeria to go to the neighboring country and other countries. So practically, we are losing a lot. I was trained with the Nigerian money, and most of these guys were trained with Nigerian money. The intention was to go back home. And for the fact, when you go back home, you had problems with those that are there, the so-called civil servants, I'm very sorry to say, they create a sort of obstacles that makes things for you to make a structure. If you are not in love with that country, you find it very, very difficult. At any rate, I have something over there that I'm doing. So I always go to Nigeria, always. Somebody was saying I was crazy. I said, oh boy, the problem is this. What are you getting here? You got the knowledge. But in Nigeria, they do this, they do that. But who are those to do that for us? We are the one to do that. It's just like somebody that was saying that the white man, they go to Africa, they make their money there. And we black man, we are, roaming all over the world, suffering. The black man, the white man, they go there, make their money. So what we have to say is that our structures, our government, needed to do something to change the structure so that those of us who are here, we don't do anything here. Imagine, what am I doing here? I will go to the normal hospital, save lives of of the people that they don't need me, because we have thousands of them here. It is in Nigeria that we fully needed. Because when they say somebody just snub and die, I had it, I always tell people that people don't die easily. I'm sorry to say that. You don't die easily if you have the minimum structure. It's not going to cost much. Minimum structure. Minimum.
Wow.
It's not costing much. Let me just give an example. In Nigeria, have a dozens of what people spend. Let me use outside the country, in abroad, medical tourism of our elites. Half a dozen. You are not. How many people? The senior civil servants, because they are having average of certain amount for them for each in a year to medical treatment abroad. Why not in Nigeria? To save life, it is not. You need minor something. It's not something serious. You can talk to other doctors. It is not something that works in the emergency, in the surgical room, in a heart, institute, neurologic institutes, and gynecology. It is not ready. Most of the things in the brain and your hand. Others are collateralized. How much do you buy a tomography? RMI. How much? It's not going to cost you $1 million. Tomography is not going to cost you $500,000. It's not. Hemodynamic to check the heart. If there's heart failure for an operation, it's not going to cost you $500,000. I'm talking of the top level. The minor something is not going to cost you even $100,000.
Now, but what is NIDOA doing to better this situation?
Yeah, what we are trying to do is that we are forming, what we are trying to do within our scope is, now, since we cannot go straight to the top level, we are trying to see that what we can give back to Nigeria. So we have some committees. We have, in which I'm part of the committee in the continental environment, that we look for something that we can do, giving back to Nigeria. For example, in my own group, in my own committee, we are trying to see that we are trying to see that we offer some lead to, not infrastructure as such, benefit to the primary schools. But now for the fact that we have to follow some protocols, we are still waiting to get authority and information and other things from the local government.
There's a question here for you. There's a question here for you, sir. But at times, I think the question is too let me see. You see, this question, I think, could it be the government of Nigeria that actually, I don't know. The person is asking, he said, why is NIDO in Brazil a little bit dormant? Activities has been secluded and somehow restricted. Could it be without proper outreach to Nigeria in Brazil or to Nigerians in Brazil? I don't know. I don't know I don't know what is he trying to ask here. You know, uh, I think proper outreach to Nigerians in Brazil. I think you need to tell the Nigerians in Brazil what NIDO represents. If NIDO is, because I think we have Nigerian community, which is not, which is different from NIDO, you know. And I think you need to let us understand the difference. Because some people think NIDO is NICOM. NICOM is Nigerian community in Brazil, which is for every Nigerian. NIDO are for selected Nigerians in Brazil or in international, isn't it? And I think it's for business people or professionals or academics or thereabout. You know, so please, why don't I think I would like you to expatiate more on that, sir, so that they can know because like they see NIDO as an organization to be secluded without an outreach to heavy Nigerian living in Brazil.
Yeah, yeah. What happens is this: is that if you're a professional, you can be part of NIDO. You have You are a tailor, you are a barber, you are a mechanic, you are a professor, you are a doctor, you are an engineer, you are a lawyer. You can, you know, it's a sort of a, let's say we can say it's a sort of professional organization, but it is not. It's something that what is if you are a professional, you can be part of it as God not according to the constitution, because it doesn't mean that because you are a doctor, uh, uh, a carpenter has got nothing to offer. No, it's not like that. So the problem, what we have here is that, as some of us, at least you have to know who is who between us here. It is not an allied group. It's not an allied group. And somebody that asked that question, he knew that he said that it's been dormant. To him, I've been dormant. But here, we've been, to streamline certain facts that we get in touch with people, if and we get in touch with the organization, the government here, the
Yeah, yeah,
government in
yeah.
Nigeria.
I
But the
think
problem is
recently you
this:
had a
in the
program there.
last 2 years, just to finish, in the last 2 years, because of COVID,
Okay.
many things were dormant.
Okay.
Many things were dormant. The only place that is not dormant in the society here, that is why you see we have the repercussion on the economy, is the hospitals. Because if the hospital remains dormant, then we are going to be in a big feast. So many things are dormant. But what we are trying to do now, why things are coming out gradually, things are resolving gradually, is now that we started making a move, to the extent that I was one of the Nigerians that use, I'm not a businessman, to go to Nigeria at least 1 or 2 to 3 times in a year, or if not 4. I was here for almost 3 years without moving out of this country. You understand? So those are the things. And if this, the question of this particular issue can get in touch with us and offer us what are the, because you are not the owner of the truth. You might feel you
Of
are
course.
doing the right thing. You understand? It's just like, telling your child that, so don't know that verdade, mas I'm the owner of the experience. But my experience might not be working for you. You understand me?
Yeah,
I'm on
but
maybe.
he's saying here that he's saying that Libari, I don't know where I think it's from Brazil here. He's saying here that the NIDO has been restricted to. So NIDO is not meant to be for selected people, but it is being restricted here in Brazil. No proper awareness. I don't think so. I don't think it's restricted.
No,
I
no,
think
it's
it's
not you know why? When
I
you
don't
don't
think so.
know, you know what happened is this in Brazil. When you go to Nigeria, I don't know if some of us you go to Nigeria, they focus Brazil as a place in which there are criminals. That is the focus. They feel that everybody is a drug peddlers, the other one is this, the other one is that. So what we are trying to do is that we want to know every one of us. Some of us we can make mistakes. There's people that make mistakes, and from there you correct your you can correct your mistakes. In life, normally it's normal. So what we are trying to do is that we are trying to screen to see that if there's any problem, we don't put. You can be not I'm a part of the members, but we make sure we don't put you in front so that if there's any problem in future, they will say, so leader of Nigerian in diaspora or some whatever call is how he's doing this, doing that. Some of us, we don't see anything wrong in certain things. So that is why we are trying to screen. We do the screen. We are how many of our members of NIDO? We have few. We have about 30, if not less, but not because we are not trying to get other people in that. We are trying to do that, but we want to make sure that at least whatever we want to do, you are part of us. We make sure that we don't have a problem in future. That is one of the reasons some people are feeling that probably it's an elite uh, 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 things. But if there's a mistake related to that, it's something that could be corrected and bring an idea that how we are going to do
Okay.
to see that
Okay,
all
sir.
this.
If they want to join, like this man now is saying that he's a Nigerian, his name is Ike Bari Egbujie. He said in 2018 he asked a member of NIDOA they restricted whatever, and that if he's interested in joining NIDO, please can you how do you expect him to go? You should ask who and who. Just let's put his
No,
own
we
case
have our
apart.
secretary. We have our
Yeah.
secretary. You could get in touch with me. There's nothing wrong about that.
Okay.
You could get in
Okay.
touch
So
with me,
please,
and I will direct him
Lebari,
to the.
Lebari, you can get in contact Dr. Yusuf Adesina. If you don't have his contact, you can contact me after the program. I'll give his telephone number. Then you speak with him and the secretary. Then you can join NIDO. He's saying here that NIDO is not restricted to any professionals, for everybody, every Nigerian. And I think the way they operate is quite different from NICOM, which is for everybody. It's a professional organization, like you said, but not that you have to be a medical doctor, a professor, whatever you are. You can always join NIDO. Thank you very much for that. Don't let us stretch that angle too much. Sir, now my question a bit, I've few weeks ago, or rather a month ago, there was a program that included Nigeria, whatever, Brazil business, whatever. I don't know. I had a program somewhere in Sao Paulo here that that involved even the minister there in Nigeria, the minister, I think commercial or something. Even the ambassador was present, which had a program there. Do you normally have such program yearly under NIDO? And I don't know, is it a yearly program? And how far has the program been? Have you, can you count
Yeah,
success? I don't know.
that is one of the things is this is that uh there are certain things that could be have been done through NIDO because we are the one that are here. We are the one that are living here, and it would have been easier and less expensive, you know, to coordinate all these things. But for many reasons or for many factors, it has not been so. So automatically, is something that it is very very difficult for me to answer that question you're talking about because there's somebody, there's some interest that might be involved. Because this had
Okay.
been done once, in which some of Nigeria, Naidu was fully involved, but unfortunately, it could not go well with the situation. So this time around, we are trying to be very, very careful and to see that anything that we are not, we don't, for the fact that we don't have enough fund and we cannot use the meagre fund we have, to feed others that are not, fully contributed to the development of NIDO. So that is why you see that our
You mean
participation in
you
that
mean you
particular
mean you
something
mean the
is not
last
very.
program there? You mean the
Mhm.
last program there?
Yeah, our
It
participation there was very
wasn't
minute.
very minute. Okay,
Yeah.
okay. So
Mhm.
that means this is like NICOM is dormant. I mean, you are seeing it's like you agree with what the young man just. You had a very mind participation in what has to do with international business relations, which we had. You had the minister present,
Yeah, exactly, because the
the
minister,
ambassador
there
present.
was a minister, the ambassador, there was a business, group, but we had a very, as far as I know, the last, I'm talking of the last listing, because you're supposed we prepared some before COVID, but unfortunately, it could not be, executed because of the pandemic. Because we had one that was prepared related to the agricultural issue and other things that we had very good participation, and we were the one preparing it, but unfortunately everything was disrupted because of COVID. So and
So,
then after that,
what are the programs for NIDO now? Now that things are getting normal, what are the programs you have
what
now?
we are trying to be in the first case is to organize ourselves here.
Okay.
Organizing ourselves here, get more members, organize ourselves, getting more opinions, for the structure of NIDO. And then from there now, we, apart from what I've said in Continental, we are trying, because whatever you want to do, you have to make sure you don't go against the rules and regulations. Now that I'm starting to work with bureaucrats and bureaucrats, that you have to write letters, you have to wait
Okay.
for letters. In my own case, through my own profession, I don't used to writing letters. No, I used to doing with my hands, work with my hands and my head, and I want it to be done immediately. So I was told that no, it doesn't work like that. I said, okay, no problem. If it's not going to work like that, let me wait and see. If it's not going to favor me, then I do it my own way. You understand me? To see that I see some productivity. So that's what we are trying to do that now. We have to contact our colleagues in the United States, where we have the head office of NIDO.
Okay.
So whatever we want to do, we can. It's going to through them, but not that we cannot do it directly, because we have our own autonomy. So is that
Okay. So
autonomy that I'm with?
you mean NIDO? No, it means it's not necessary that NIDO must work with the Nigerian embassy. You can work alone without the embassy.
No, it can work. No, it is natural that it should work with the Nigerian embassy. But if there's an obstacle, we see no reason why we will not work, because we are not being
But
we are
right
not
now, what is your?
our financial stand is not from the government, it's not from the embassy, it's ours.
But
So
you work with
automatically,
Abuja,
we work
right?
with embassy.
You work
If
with
we have
Abuja.
embassy backing, the better for us. If you have embassy backing, it is better for us, because it will be easier when you go to the organization here, any organization or any government something here, and knowing that the embassy is giving us a sort of a backing, then it will make things very official for us. It's an opportunity for us. You understand me? That's it. But we
But
try to
now,
be
if you
more friendly with the embassy, and the embassy is trying to be cooperating with us. That's what we are planning to do for the next session, is that we want to make a frequent chat with the ambassador.
the
So from
ambassador,
there now, and he has agreed over that. Now from there now, we'll be able to expose our views related to the problems here, how we are going to resolve them, what are the problems, who is going to resolve, how it's going to be resolved, another thing. So that is the objective of this charge. And he agreed on that. So we are on it. Very soon, I think it's going to be out, and to see that we that is done. And the other thing we are trying to do is that everybody knew what when everybody was in Oluwatoyin's uh,
Yeah.
burial. I was not I was not as I was not happy with the environment. I said we could do something better. So we are trying to see that if something like that happen, then we had a place. So we are discussing that how it's going to function, because there is legislations, there is rules, there is norms that somebody has, especially when it involves organization. But we are trying to find out how that is going to work. So it's one of the things that the NIDOA here is planning to do, at least that can benefit one or two of us who are being in that particular situation, and and what to do.
Sir, let me just ask you, and beg you. Sir, Nigerians, they've seen, or rather, many related with Dr. Oluwatoyin as somebody very closer, some person, I can't, in fact, difficult to find the word to. Can we find another Oluwatoyin in you? Are you there to be the father of Nigerians that are now Nigerians in Brazil that are practically fatherless because they lost their father, Oluwatoyin? Can we say Dr. Yusuf Adesina is the new father of Nigerians in Brazil?
It is very, very difficult uh, to answer that question. Dr. Oluwato is unique. He's
Unique.
communicative, he's friendly, he go about, he's structured as a person. He's quite
Hmm.
different from Dr. Yusuf.
But we still need a doctor that will be closer to every Nigerian, just like
Ah,
Oluwatoyin.
so
But
automatically,
if you cannot do
that's
that,
been,
you're
yeah.
going to present one to us.
And there's another
We need
thing.
one.
Dr. Oluwato was very close to Nigerians. Look at the structure where Nigerians are staying. It makes where Nigerians are staying, there are many Nigerians in his environment, where his structure is. So it makes things very easier. Not that Dr. Yusuf cannot, serve Nigerians. It is even when somebody, comes to me, I ask him, where are you staying? In order to know how far somebody can help you or somebody can assist related to the health issues. Where are you staying? Because it depends on where you are staying. Somebody who has, when got, something that is passing through certain health difficulties, to move from one place to another, it makes things very, very difficult. And most of the time, we say, okay, you go straight to Oluwatoyin. Or when somebody is around me, Oluwatoyin will tell them that you come and meet me. Those are the changes we were having when he was alive. But since he's not there now, what we are going to do is just to accommodate. We try to modify our lifestyle to see what could be done to block the loopholes.
Okay, so you promise us now that meanwhile you are the one that will organize a better way to helping the Nigerians that are fatherless right now in Brazil.
Yeah,
Oluwatoyin, yeah, so Nigerians listening to us, Nigerians watching us in Brazil, Dr. Yusuf Adesina, he's not saying it's Oluwatoyin or he will do like Oluwatoyin, but he has promised to diagram a way, at least to reorganize a way that we can regain another father that we lost. Maybe he's going to give us another medical doctor of his own, or he's going to give us another person that will be closer to us. NIDO, NICOM, we are family, either we like it or not. Nigerian community in Brazil, Nigeria in diaspora organization, we are one. Either we like it, we are all Nigerians. So if we don't
just
have
to
our
make you
father,
aware that Nigerian community started with me. We started
wow,
Nigerian community when we were students.
okay,
That was about 40 something years back.
yeah,
We were students. The first president was then uh, Mr. Balogun.
okay,
Then we have, even though I'm not mixing, we have Dr. Ifidon, Lawrence Ifidon. Then,
okay,
you see, so I was part of the organization. We founded that because we had some problems and we resolved our problem through getting ourselves together, and that is one of the things that is when you are together, you get things easier than when you are isolated or when you are not together. So that is the essence of getting together. So I'm very grateful that the Nigerian community is still existing, and and I hope
and it's
that
waxing stronger, it's getting stronger. You know, Nigerian community is now like we say in Portuguese, under Patama. It's
yeah,
moving, and I think I can see that even the community is and with you now, I'm very sure that we will meet together, Nigerian community, NIDO, and definitely we're going to reach the promised land. Let me say that way. Sir, I think before we go, I know you have your, as a doctor, you have your programs here and there. I wouldn't like to take much of your time. Uh, Few Nigerians here are still saying that NIDO is restricted to some people. Please, I would like you to just, if it's possible, you say it here, the name of the Nigerian person, the NIDO person that they can contact if they want to join NIDO. They can pass information to them about NIDO, the person that they can contact, and your bull, and you must have how you set information. Who is your PR? Somebody that they can always contact, they can speak with, they can give them information. You know, please
but
just say it here so that they can know the person. You are the
yeah,
president. You
you're
have your
okay.
PRO.
Oh no, I'm the type of person that uh, I don't discriminate. So
Yeah.
in Naidu, anybody can be could be contacted to
No,
be
no, no.
part.
But that should be a
Let me
protocol,
tell
sir.
you, the vice president Uche could be contacted, the secretary could be contacted, Shika could be contacted, John could be contacted, myself, contacted. So we have many people, to make contact with. So,
Sir, sir,
but
can you
then
can you
the
give me
secretary,
the email of NIDO? Let me just put it here for them to see the email or telephone to
no, then
contact or email.
I will get that. I will get that, and then you they will
Okay,
get them.
okay.
I don't know the offer
And
now.
if Chika is watching us here, if he has the number, he can just type it on the
If,
on
yeah,
the
Uche
or
is
Uche
having that. They have the
is not
email
here.
and all that.
You can type the email and the contact here on the board so that our viewers can see. They can easily contact NIDO. He's saying that NIDO is not restricted. That NIDO is for everybody. Sir, NIDO, I think we have Madam Abike Dabiri as the as the diaspora representative there in Abuja. One of these days, I think I spoke with her one of these days concerning a Nigerian that relocated to Nigeria from Brazil, a Yoruba person who, after several years in Brazil, relocated to Ibadan, where he started his business. But along the line, he was picked up by a vigilante, how do you say it in Nigeria, was beaten up. He was caught into you know, and he succeeded in picking his passport and ran back to Brazil. You know, as a journalist, I published the tragedy, and I was contacted by BK Dabiri. I was contacted by the embassy concerning the publication, of which I presented the person. The person is back in Brazil and has promised never to step Nigeria again. He abandoned the family, the wife, the house, everything, and ran to Brazil. He promised that as for him, Nigeria is over. That he took his money back home to start a life. He was caught by the community people. He was cut into pieces. He nearly died. He was beaten like a thief. He picked his passport and ran back to Brazil. And he contacted me. We published in the newspapers, and of which he promised never to go to Nigeria again. Sir, as the president of NIDOA here in Brazil, is there any way you can communicate Abike Dabiri, the Nigerian government, the embassy here, for life security, for an eventual relocation to Nigeria? Nigerians are going back home. Recently, you had you had a conference here in Brazil where you are inviting Brazilian businessmen to go to Nigeria and invest. What is NIDOA doing about security? Security in Nigeria, security of Nigerians relocating home, the business security. Is there anything you are doing, or what do you think we can do together?
It's something. It's an issue that is uh, uh, that's got a sort of a political, to uh, intonation when you talk of security. When you don't have health, when you don't have education, when you don't have social justice, when you have social injustice, there's no way to tackle security. Health, education, social justice, there's no way. So to me, it doesn't depend on me, what I have to do, because I'm sure they know what to do. In a place, I'm the only one. I've just said, I've been to Nigeria. Let's say I always go up 2 or 3 times in a year. In a place, when you see a politician, going about with about 3 or 4 security men with AK-47, do you expect security? It is very, very difficult. You don't need somebody with AK, 3 people with AK-47 to be going around with the family. We don't see them here. So automatically, you see now somebody that's not prepared psychologically, handing bad salary, and you want him to be responsible for the security of the society. It is very, very difficult. I don't know how, I can answer that question you're talking about. Because even when we get in touch with when we're going to get in with Dabiri, he will tell us that these they are taking the measures, they are doing that. He will tell us, will not say they are not going to do anything. But what I mean that when you are able to resolve social justice, look at what I'm trying to say now. Look at the university students. It's painful. University students have been something very minute. It's not. It shouldn't be. They've been they've been in on strike. I don't know, for the past, if not about 4 months now. Imagine you train somebody with the brain. Those guys that are very intelligent, you forget about them. What do you think they'll be thinking? It makes things very, very difficult. And you, as a person, you are in a very good, situation. Thinking that if you carry about 4 or 5 security men along you, and you use your position to oppress others, it makes things very, very difficult. I don't know how I can,
Okay, sir. I understand because it's a little bit
this
political.
security you are talking about. I don't know how we can here. We can talk over there, but they know how to do it. But is there any political way to do that? I don't know. I
Yeah,
don't know.
understand you, sir. Sir,
Because I know they
here
know.
in Brazil, here in Brazil, sir, we have a lot of professionals in the streets of Brazil. We have Nigerians that are schooled, that left Nigeria as graduates. They are there in the Galleria. They walk in the streets there. At times, we don't know that they're schooled. Many of them came here as graduates, some having master's degree, but they are here in the streets of Sao Paulo. They could not find their way into the system. The
Yeah,
system.
that is where Naidu can come in, because there's what is called uh, uh, revalidation of
Yeah.
certificates. That is where we are going to get. That is one of the reasons why we want to chat with the ambassador. We want to have a chat, frequent chat with the ambassador, so that we'll be able to see what could be done in these you know in this type of issue you just mentioned. So that so by chatting with the ambassador and the educational uh, sector here, we will do a sort of revalidation of the certificates of these professionals and the way forward. But that is
Okay.
one of these. The thing is that we are going to send you the email. I will try to see that before the end of these so that the
Yeah,
third person will
because
get in touch with us.
if I've run across a number of Nigerians that are professionals in the streets. There's a question here for you from Nido Europe. So, Doctor, please, does Nido Brazil work with other stakeholders and Nido Europe?
No, what we work with Continental. We work with USA. I mean, Nido America. The Nido
Nido America,
America
okay.
in contact with Nido Europe.
Okay.
That is
Okay.
how it
That's thank you
works.
very much. No, it works. Okay. Thank you very
Mhm.
much. The
And
question is
Nido
answered.
Africa and another part of Nido.
That part of the world. Okay. So I think you should just designate a particular person that will be ready to always attend to Nigerians who are still not very satisfied, that are still thinking that NIDOA is a bit restricted to certain people in Brazil. You just designate a particular representative of NIDOA that will always listen to them and answer their their questions. After the program, they're going to contact me so I can easily direct them to the person. You know,
Yeah.
because
I will send you to get in touch with Femi and Uche
Femi,
and Uche.
yeah, okay, Mr. Femi Onosoya, isn't it?
Femi,
Mr.
Femi and
Uche,
Osoya.
Mr. Uche. These are the two representatives. They are the
Yeah.
ones to handle everything concerning NIDO and Nigerians in Brazil. So
Yeah.
after them, then you can speak with the Honorable Dr. Yusuf Adesina. Doctor, not to waste much of your time, I think I won't leave you without a difficult question.
Yeah.
Uh, of the
Yeah.
three of them, of the three of them, are we choosing one?
No, you can. You can. You don't have to. You have
Of
to.
the of the three of them, you have a candidate. Are you for Obi? Are you for Tinubu? Or are you for Atiku? I'm not asking you.
Yeah.
I'm not asking you to answer. Answer if you want to.
No, you have to. That's got nothing to do. Let me tell you something
Yeah.
about politics. Politics is like this. We don't have to be, naturally, we don't have to be worried if it is the party or where they come from. We have to be worried about the programs if
Yeah.
somebody has done something before,
Yeah.
because most of them they be in the system. It's just the same party. They do a sort of a crossover.
Crossover. All right.
You know what is called crossover?
Yeah. Yeah.
Most of
Yeah.
them. We've never
Yeah.
seen, the last time we saw Showore was trying to do, but in his own case, it was not the way it should be done, to my own knowledge.
Uh-huh.
It should be in another way. Because
Okay.
politics, is a very dirty game. Anywhere. We leave politics here, you know, in Europe, in America. Imagine in Africa where, people are not yet used to certain, things of democracy. It's a very dirty game. So imagine people crossing from one place to they've been there. They've been there for almost 20 something years. If
Hmm.
not, they are out there. So it's what have they done when they were there? So that's the issue. It is we have to just look at the past record. If they done something for us when they were there, little or no, and to see that if something could be done. Because unfortunately, we could not get the young ones. The young ones, we have few, one or two, but they've been participating. But when we're saying young one, somebody should go through the learning curve. What I mean the learning curve is this. At least, okay, you want to be part of NIDOA, as I'm just saying. At least you have to be, in the first case, you have to be a member of NIDOA, holding a
Yeah.
meeting with NIDOA.
Meadow. Yeah.
You understand me? To know how we talk, how we abuse ourselves. Because there's a way to abuse somebody elegantly, and it might be annoyed with you, it might not be annoyed with you. You understand me? So those are the things, those guys that are there, we are not able to change them because they are in the system. So what we have to do is that what are the programs they have for us?
Hmm.
Are they going to increase the quality? Benefit the quality of life of our country, of the citizen? Are they going to create employment? Have they created employment when they were there? Are they going to make a country a very secure place? Have they done that before? Are they going to, make our university to be working? Have they done that before? Are they again? Are we going to have a very good wage? Are they going to bring our professionals back to Nigeria? Those are the questions we ask them. Not because it's from the I'm from Abeokuta, I'm from Ondo, or from not that, or from Kebbi, or whatever they say they come from. Not that. What Nigerians need is they want to live well. They want a good job. They want a good health. They want a good transport system. They want security. Those are the things. Are these people are going to offer us at least a reasonable percentage of what you are asking for? This is my questions to them. So it's not question that I'm this party or I'm in favor of that. I want
The
good
best.
activities. I want good things for my country because I don't have any other country. If you send me to Zimbabwe today, if you send me to America today, I might go to jail. If you send me to Europe, nobody will know what is going on. If you send me to Nigerians, Nigeria might say, at least if somebody put me in jail now, I will have somebody, there's somebody that they will talk to, or in one place or the other, and say, oh, that boy, why do you put him in jail or something like that, whatever. So what we want is social justice. Social justice. What is social justice? The professor is earning well. The boy from the university is having a job. The common people, they have health system or transport system to go to their working place for the country to move. That is what I pray that any of these guys should do, whatever is inside. So
Thank you
that
very
is my
much for that.
way of.
Maybe we hope. Anyway, let me not say, but I think having somebody like you in the Nigerian system, the political system in Nigeria, maybe we're going to have a change for the better.
It is no, we have thousands of them in Nigeria. We have, because you don't have to be a radical. It is easy. It's just a matter of knowing how to talk and listen to people. Imagine somebody is hungry. You want him to be, you don't want him to be aggressive.
Yeah, that's it.
He's going to be aggressive. So you don't know what to, but you give him food and tell him this is what to do for you to make your living. Imagine the way you don't create a means for somebody. You want to give him money. You don't have to give money to anybody. Just create him. He doesn't need your money because he knows that your money is temporary. But just give him the avenue for him to move. He will create his own wealth. He will create his own, means of living. And they are very, very simple to do. If I refuse to just put everything in my hand, look at, let me cite example. Somebody wants to give a moral, moral opinion. Look at in the first world. When I say in the first world, the British, the Americans, and other places, they say the third worlds are corrupt. But when millions of their money is in their country, even the World Health Organization or what's the name of United Nations, none of them will fight against and say, this man stole the money of the poor people. They should send him back with the money. No, they don't do that. And they want to give us lectures about moral, etiquettes, corruption, and others. Those are the things. I steal money from my country. I go to the other side of the world. They embrace me with my money. I will not go to jail in that place. They say they are following the protocol, and the person will be there. And then people are dying on the other side where this money is not there. You see? So you find it very difficult. You have to sit down and think if you are not the one crazy or the other side. So that is politics. It is very, very difficult. So what I want for the society, whatever somebody is doing, is social justice. You have opportunity, give opportunity to others. Because it's just what will happen. If you are going to die, you don't take the money away. Everything will be here. Or whatever you live in, whatever it is. So that's it. Opportunity, you drive it to others, not to your family alone. Because your family is so easy. With age of 24, everything is okay. Age of 24, 25, you train everybody. They will know how to move. They don't need you anymore. They don't need you anymore. If it happens, there must be mistake somewhere. There must be mistake somewhere. Age of 24, you're out of the college. The guy is going to move alone. You are not the one to say, I want to go and pay for the master's degree. It's a mess. You are not the one to do that. Let him go and work with what he has got. He will do his master's and the PhD on his own. You are not to do that.
Yeah, but so Nigeria actually changed. The system actually changed. I was fortunate to have schooled earlier in life, So the system changed. The system changed. The society changed, and we are changing too. So it's better we change for the good. Thank you very much for this interesting program, sir. You've spoken even beyond what I actually expected. I've always been seen as somebody very timid, you know. But today you've been able to to tell the Nigerians in Brazil that you are there for us. Dr. Yusuf Adesina, Dr. Bamidele Adesina is there for every Nigerian in Brazil. He's saying it here categorically that he's there for us, though he has his time a little bit tight, but he's always there for us. He's the president of Nigeria in diaspora, America, Brazil. He's saying here that NIDOA is not restricted to anybody. It is for Nigerians. If you feel the necessary requirement to be a member, definitely you will be admitted as a member of NIDOA. NIDOA is for Nigerians. Nigerian community is also for everybody. You take your card, join the community, and please subscribe to the channel. Yeah, subscribe to the Adeyinka Olaiya channel. This is a channel for us in Brazil. This is where we communicate the international community right now. We communicate the world through Adeyinka Olaiya channel. Subscribe. And whatever way you think you can also contribute to making this channel a better one, never hesitate to contact me, contribute, help us, support the program, let it be up. This is the way we are able to channel our situation to Nigeria and the entire world. Sir, you want to say something, sir?
Just to correct the issue, when somebody sends, get in touch with NIDOA, we are sending a form and we do a sort of a screening to know who is who. Where are you
That's
doing?
exactly what I'm saying now.
Exactly, so that we don't, implicate ourselves, so that we will know where to put you in our list, in our if you are going to be part of the executive, and all those things. And because we have something to extract from those that are coming in, because for the fact that we are on this side, we might not know what is on the other side, independent of the knowledge we have. So that is why we would like people to come in and tell us what is going on, what could be done, and all that. Because if I don't know your problem, I will not be able to resolve it. So that is why I have to ask. I cannot just go, I want to get you a house. When a house is not your problem, I want to give you a food. Maybe that fooding is not your problem. You understand me? So that is the objective of getting closer so that we can know what is going on and where to transmit these to.
Thank you very much, sir. Another important thing, I think we have a lot of Nigerians too in the streets that are a little bit, a lot of Nigerians that are not, I don't know how best to say it, but I think if you can form, if NIDOA can also organize a group to help Nigerians in the street, I think it would be good. Nigerians are there, stranded in the street. They are in need of one or two. I remember there was a time from Nigerians at the airport, they were stranded. I was called and I was able to speak with Dr. Luatui, who immediately resolved the situation then. From his personal pulse, he's been able to resolve a lot of Nigerians walking in the street. He's been able to put things straight. I'm also appealing to NIDOA. I know NIDOA is more for professionals, but I'm appealing on behalf of Nigerians in Brazil.
Just to put what you have just said related to the, immediately we heard of that, NIDOA did his own participation related to the guy you're talking about. To the extent that today, this guy is part of NIDOA in Brazil.
Thank you very much.
You are talking about.
That is very good.
And there's what you mentioned is that most of the things, when you don't do things, you don't, let others say what you are doing. We arranged, there was during COVID something, we were able to arrange, to help some Nigerians, during COVID period, that we were able to arrange certain sister basket from some Nigerians. I don't know how many thousands of sister basket we did that time at the city. Okay. We went to, different places to distribute this thing to Nigerians. And what you just mentioned right now, we are, somebody that been mentioned, and something, we are about to discuss something about it. Because you don't, it makes things very difficult when you promise something you don't do. We want to do first so that other we see, so that you don't base that only on promise. Not that we are not been trying to do something for our people here. We've been trying to do, and just only it's not been doing a sort of publications. It's just like the last issue. NIDOA has done something to the family of our late uh, president. You see, it's something that we don't. There are certain things that you don't like to, publicize or to do a sort of propaganda. So, but when you mention something, something will be done, and from there, others will just ask. They've done this for us and that. So we try and see what is going to be done related to that. Apart from the that it is not, our it's
Yeah, yeah,
it's just mentorship. What happens is this. That's why mentorship is very, very important. If these guys, because normally in those days, when somebody is new here, there was an avenue. But unfortunately, that structure is no more there. When somebody is here, there's always an avenue, what you are to do first and what you are not to do. But right now, it's not there. So what we are trying to do, we try to build this avenue to bring back this avenue. Maybe it's going to help us as a sort of mentorship. Somebody will just come instead of wasting time. We know where to go to. Okay, thank you for the,
So,
at least.
anyway, you just have to promise us that when next I invite you here, you are here to attend to us. Just thank you for this late opportunity. Thank you for accepting the possibility of addressing us. I rather use address because we've enjoyed you
Let me,
from the health. Want to say something?
yeah, let me send you just a minute. I want to try to get you
The email. So while he's doing that, please subscribe to the channel. You see it up there. Subscribe to Adeyinka Olaiya channel. Be part of us. Join us always. And you can still ask your questions while he's trying to get the email of NIDOA. However, he mentioned Honorable Femi, Honorable Uche, Chika. They can be contacted for those of you that want to join NIDOA. He
I
also
think I sent
mentioned
it to you.
okay. Oh, okay, let me see. Uh, he made mention important things regarding our health. Do exercise, eat well, less stress, visit a doctor at least once in a year. Following these things, you can avoid heart attack. And if you feel that you're feeling bad, or if you notice anything, even you go to toilet, your urine, if you notice the smell or go straight to your doctor. Let us keep ourselves well. Let's be alive. Like he said, you have to be alive to help others. Let us be concerned really with our state of health in Brazil. We've lost a lot of Nigerians here to heart attack. Please He is a cardiologist. He is a medical doctor of experience. He is here. You can always contact him too. Let us keep ourselves well. Avoid cholesterol. Do not smoke. He said, do not smoke. Don't say, no, I smoke it now. Do not smoke. Smoking cigar is a channel to hell grave. He has said it here. Let us keep ourselves well. NIDOA is there for everybody. Please contact Uche, Honorable Uche, Honorable Femi, and so they are there to listen to you. NIDOA has been helping. Like you said, they once organized Sister Basca for Nigerians in Brazil. They've done a lot. You can always contact them. They are there for you. NIDOA is a Nigerian organization here in Brazil, around the world. The NICOM is there for you too. Please join NICOM too. Let us be one. Let us move Nigeria ahead in Brazil. While we are still Nigerians, let us be Nigerians. Sir, you want to say something, sir, before we run the program?
Yeah, yeah. I sent the email to you
Okay,
already, so you
let
can
me check
put it in the
okay,
flam.
put on the yeah, because my okay. And
No, I
another
just
important thing, sir.
I just want to repeat. In
Yeah,
the first case, I thank everyone, for taking this time to hear what I was about to say. And just to repeat, for you not to have heart failure, make sure you drink water, 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 right? So as like that, we not overwork the heart because the heart is not crazy. When there's no water in you, it has to work more to give your brain, your heart, another part of the body or the prime, organ something. Make sure you control your blood pressure. Make sure you control your cholesterol. Make sure you sleep well. Make sure you control your diabetes, that your sugar contents in your blood. Make sure you don't stretch yourself. This doesn't depend on you. Make sure you eat good food. Make sure you eat plenty. They're gonna, full of plenty, plenty of fruits. It is very
fruits.
good, very cheap here in Brazil. Fruits. They call it anti-cancer. Any fruit
Wow.
you eat,
Breast cancer.
anti-cancer. Yes. Fruits.
Wow.
Anyone. We don't have to. Very cheap. Make sure it's not. So those are the things that at least we can benefit from, to our health. And exercise. Very, very
Exercise.
important. You don't need to go to anywhere to do that. You can do it inside your house. While you are, in your micro, you want to eat your, your micro is working, use that at a time, be jumping. Just jumping. Why the micro, when it is 5 minutes, while maybe you are cooking something in the kitchen or your wife is doing something or whatever you're doing, instead of sitting down, you keep in jogging. You can jog inside your house. 5 minutes. You can do push-up inside your house. There are many things that could be done inside the house. It helps the heart. Thank you very much
Wow.
for viewing me
Wow.
and for
Bro, I
the
don't even
opportunity.
know. I'm just hearing that now. He's saying that any fruit you eat is anti-cancer. And Brazil is blessed with food. We're blessed with fruit. Please get yours and eat often. Let us avoid this heart attack in Brazil. Enough is enough. Enough is enough. If you want to join NIDO, please. This is the contact. You can see it. This is the NIDO email, the two emails, .gmail and .org. You can always contact them through the email. NIDO is for everybody. You go through the screening, and if you are screened and you are found okay, you will be allowed to join NIDOA. Dr. Yusuf Bamidele Adesina, I thank you very much for joining us. Oh, let me also thank my alma mater, the Great Ife. I thank you all for the Brazil chapter here, for watching us, for following us here. Thank you very much. I thank African Cultural Center, who has been participating, been helping us in the program. I thank every Nigerian. I thank my Yoruba people. Today it's English. I thank you all for joining us in this interesting program. Doctor, you have been so
Thank you for having
wonderful.
me.
You have been so
Thank you for having me.
wonderful. Yeah. Thank you for having somebody like you. I can say categorically that we are proud of you. We are proud of you, and we will continue to be proud of you. You are our doctor. You are a cardiologist. You are an example for a number of us to emulate. Thank you very much for joining us. Thank you very much for this lecture you have given us. Thank you very much for all you have said from the beginning to this present moment, for selecting that time to speak with us. I appreciate you. Nigerians in Brazil appreciate you. Adeyinka Olaiya appreciate you. And I'm very sure with somebody like you, we will move every day stronger, better, and we will reach the promised land. We will still see a better place to live. We will make Brazil a better place to live as Nigerians. And I hope that in the future, if we still remain as Nigeria, we will make Nigeria a better place to live. You are an example. You said something that you go to Nigeria 2-3 times a year, that you are doing something there. Even with over 40 years in Brazil, you're still telling me that you are a Nigerian. You like your people. Olodumare will continue to guide you, protect you, and give you long life. Thank you very much for joining us, Doctor.
I'm grateful for having me. Thank you.
Olodumare wà pẹ̀lú yín.
All right.
Thank you very much. And those of you watching us, next week we are back again. Join us. Let's celebrate another doctor. I hope so. Doctor, Olodumare wà pẹ̀lú yín. I'm a Yoruba
Thank
man.
you.
I have to head up with Yoruba language. You ma ju yin
All
ṣe.
right. Thank
Ẹ̀yin
you
tẹ́ ń
very
wò wá
much.
náà.
Yeah.
Thank you very much.
Yeah.
God bless you. Please subscribe. Doctor, subscribe to the channel. Have you subscribed?
All right.
Support the channel.
Yeah.
Thank you
Okay.
very much. Thank you very much.
Bye.
Thank you very much. Thank you very much. And thank you very much for this program. I thank those of you that have started with us. And I'm very sure that the little you have heard of Doctor today, you will definitely see reasons to why you have to keep yourself well, take care of yourself, so that you can take care of others, you can take care of us. God bless you. You have a wonderful day, a wonderful week. Be with us. Subscribe to the Adeyinka Olaiya channel. Health is wealth. Thank you very much. Bye-bye.